Sorry. Were you going to, are you presenting here?
Yeah, but I'm way early too.
Okay,
We won't be long.
So keep doing that.
Maybe I'll guard the door outside.
Okay.
I'll guard the door outside.
Sorry about that. I'm here with ACEM President Simon Judkins at the 2017 ASM, and he's going to talk to us a bit about his presidential address yesterday, in which he said social equity, fairness and justice are actually the business of doctors and important in health.
Yeah, I think for emergency, so we spoke about this yesterday, and I think for emergency physicians and our trainees and our emergency departments, I think the concept of, or the ideals of social justice, equality and access is stuff that we live and breathe every day. As anybody who works in the emergency department knows, our doors never close. People, whoever turns up needs our help, needs our treatment. It doesn't matter their background, their condition, young, old, we treat whoever needs their help. And so the concept of, as I said, equality and social justice sits very comfortably with us. But working in a system also, I suppose, that you know, has, we see differences, I think, across the systems, and realise that a lot of these people who are essentially quite vulnerable really struggle to get their healthcare in any other forum, so, or any other way. So, in fact, emergency medicine and the role of emergency departments actually evolved over the last, you know, since the college started, because of some of these issues. So we have like mental health patients, for example, who struggle to get access to care in any other environment, and when the crisis comes, they come to the emergency department. So we do see a group of patients who struggle. It may not be an emergency in the, I suppose, in the traditional sense of what an emergency is, but for that individual, it's an emergency because it's a life-changing event. And so whether it's due to, you know, social issues, drug and alcohol issues, you know, it just, I suppose, has become part of the work that we actually do. Which I think is quite interesting, because I don't think a lot of people outside emergency medicine realise that's part of our role. If you look at, you know, the TV view of the world, you know, every second patient is a trauma victim, every second patient's having a heart attack, and we are saving lives left, right and centre. But, you know, we still do a lot of that. You know, resuscitation, the trauma is core part of our work and core part of our teaching, but we're increasingly evolving into a specialty that, well, as I said before, looks after everybody who needs our help.
So yesterday there was a really interesting session in the morning that talked about, I guess, gender equity in your college and, you know, in medicine more broadly. And it was said, you know, it's unacceptable that your board's 100% men. So yeah, I'd like to hear your thoughts on that and where the college is going. Yeah,
I think, look, the conversation yesterday was fantastic. We welcomed that feedback, and I think with any of these issues, whether it's gender equity, whether it's you know, diversity in our members, whether it's issues of discrimination, you know, this meeting is becoming that forum where people can get up and express their views and express their concerns. And the conversation we had yesterday was brilliant. You know, people might agree or disagree about the mechanisms, for example, about how we do it, but at least we're open and honest and having that conversation, which allows us then to move forward. So I think, you know, nobody could really disagree about that we. Well, first of all, I think we're heading in the right direction as far as gender diversity or gender equity goes on many of our bodies, and we are obviously that data is out there for everybody to see. But obviously, the next step is really to get through that clearly to that sort of the board level and that and the presidency level. And you know, it's always very interesting walking into the role as a new president, and one of the first things you're having a conversation about is, how are we going to get the next president to be a female? So it's making me feel a little, you know. So that's an interesting conversation to have. But you know, I've really enjoyed being able to hear people's views about that, and I think you know, emergency physicians are the sort of people who get stuff done. So I have no doubt that this is something we will just get done because of the passion of the people involved.
How do you think we've come to this situation? I mean, obviously, ACEM's not alone in this having this problem, but what is driving it?
What's driving it? I think, look, I think there are lots of issues along the way, and I think no doubt that, again, from my perspective, I think because I've had a much easier path, I think, to this role. As I said in my speech yesterday, I was being a middle-aged white guy, you know, I was born in Melbourne, I went to a nice private school, and every job that I went for, you know, I was successful in getting. There's no doubt, you know, there was a lot of hard work along the way, but unless somebody stops and taps you on the shoulder and says, hey, hang on, sometimes you just don't really look at your own path and realise that it's very, very different from a lot of the people in the room. So it wasn't just, well, it made me reflect on not just the struggles that our female FACEMs have getting into, the work-life balance, but also overcoming the barriers that are put in the way, but also, our Indigenous trainees, or somebody from some of our overseas graduates who have the same sort of battles, and so I think it's made me realise that it's not just the gender equity issue that we need to address, but it's also racial diversity, and it's also and racial equity. So we need to look at all of those issues, and I think we're going to be very proactively sort of trying to address them and tackle them over the next, at least in the terms of my presidency. But hopefully that will continue to address those.
Yeah, there was some talk yesterday, obviously, about the exam issue and the allegations of racial discrimination, and ultimately that was found not to actually be the case or the reason that the exam results were as they were. However, the review did say an apology was needed.
Yes.
Yeah.
Yeah, and I think and Tony Lawler in his speech has made that apology, and certainly my sentiments are exactly the same. I think what the EAG has done, we shouldn't call it the EAG, but what the investigation into the exam has done is actually opened up a whole lot of things that we really weren't aware of, and sometimes we'd gone through quite a significant change process around the examination process and training, and until people actually stop and say, hang on, look at this. Sometimes you don't see what's in front of you, and I think for us that whole process has actually been, in a strange sort of way, has been a welcome process, because it actually made us stop and think about everything that we've done along the way, and it really has given us an impetus to really change, the way the college approaches, supporting our trainees, and addressing all of these issues about, as I said, diversity. One of the things we're doing out of the DBSH work is developing a committee about inclusion and diversity, which is going to be a body that will report to the board and will continually monitor, implement change, report back to the board about how we're going in areas of inclusion and diversity, and make it clear that that is one of the the priorities of the board, which hopefully in 2 years' time will be a very different looking board. It's been I suppose a difficult 12 months, but at the same time it's been a very inspiring 12 months, because it really has made us realise that there's a lot of passion and a lot of people who in our emergency physicians who really want to make our college and our profession and the healthcare system, I think, generally much better than it is.
Well, look, you made that observation yesterday that, in fact, cultural change in the ED can trickle through the whole hospital and perhaps the whole system. Yeah,
I think, look, again, the number of conversations I've had over the last couple of days, over the last few months, the last 12 months, the hospital system itself generally is a place that I personally think needs to change significantly. Not only in terms of gender equity and diversity and the things that we've been talking about now, but also in terms of understanding that the hospital system is about people, and it's not about widgets, and it's not about key performance indicators. It's about looking after patients, looking after staff, and I've had multiple examples from visiting various health networks that there is a problem out there about bullying and discrimination and not supporting their staff, and some of these environments that our emergency physicians and trainees are working in would be described as being hostile, and that's a really sad thing to see when you're meant to be working in an industry that cares about people, It's all about caring for people. It's called a healthcare industry for a reason. And we clearly don't see that. And so part of our work, I think, at ACEM, or certainly part of my work as president, will be standing up and calling out that behaviour and going beyond the incidents of bullying in the emergency department or within the surgical unit, but actually holding some administrations into account, because that's where the rot starts, and that's where we need to change the culture. And if if we're only addressing it at the coalface, but you still have an executive that is clearly, an executive that doesn't understand how to treat people, then you're never going to get that change. So, this needs to be a system response, and I think emergency physicians and our college sit well. They're in a good position to start, identifying bad behaviour and calling people into account.
So on the topic of bad behaviour, we heard about the DBSH survey findings. Could you take us through some of the major ones there?
Yeah, so the major findings there were around around 50% of the people who responded. So we surveyed all of our trainees and physicians, and we got a response back of about 44%, which is over 2,200 respondents, and overall describing any of those behaviours, discrimination, bullying or sexual harassment, was around at 50% of the people responded. 34% identified bullying. There was quite high rates of discrimination. So, and that's incredibly confronting. I think, as I said before, emergency physicians, we've always felt that, we have a much more collegiate, team-based level sort of structure, but obviously there are issues out there. A lot of it's perpetrated by emergency physicians. A lot of it was about interactions with inpatient colleagues and teams as well. But a lot of it also goes back to that point of, working in a system that's under stress as well. And there's no doubt, as Tony Lawler said yesterday, even if you are in a system that's under stress and you're resource poor and you're worried about patient safety, it sometimes is very easy to snap. But you also need to make a conscious decision about how you're going to respond. But again, I think for those behaviours, I think one, again, identifying it, talking about it will start to make things better, but we need to put more structures in place so we can make sure that we monitor it and make sure our trainers feel safe to speak up, which clearly, again, I think not only with our college, but any other college has been interviewed on this. One of the big things is that people don't feel empowered to speak up, and it doesn't matter whether it's our trainees or any other industry. We just need to make sure that that the people who are being impacted by these behaviours feel as though they have the right people to go to.
And what will your priorities be as president, just finally?
I think we've been through quite a lot of them already.
Yeah.
I want our trainees and our fellows to really re-engage in that common sense of purpose about why we do this. I know we work in environments that are stressful. I know we work in environments where we feel that are resource constrained, but we do very, very good things every day. And I think people need to, and I think the job we do, we should really respect and treat as a privilege, because you don't get to change people's lives every day in many other jobs, and we do. So if you can walk away from your work every day and say, well, I've done some good things today, despite the bad things that happen, the stress. I think if every emergency physician or ED doc walked away from work and said, whose life did I change, or whose lives did I impact, what good thing did I do today, you'd walk away feeling as though you've made a difference. That's the thing that I really want people to understand.
Well, good luck with that mission.
Thank you.